I'm Pilar Trelles. I'm a child and adolescent psychiatrist at the Seaver Autism Center for Research and Treatment. I also lead a psychiatric clinic at the Developmental Disability Clinic at Mount Sinai West, where I act as one of the co-directors. I'm very grateful to be here sharing with you some of the things I've learned in this global crisis. I think one of the biggest challenges that developmental disability community experience overnight was adapting the way we had been providing care and helping individuals with autism overnight. Obviously, the biggest challenge came for families, for parents who just, they went to bed one day and the following morning they were therapists of their children, and, teachers learning, becoming behaviorists and finding ways to help them all while many still working and taking care of their homes, their other children. And one of the things that has been incredibly impactful for me has been how they've been able to navigate this crisis with kindness and good humor and sensibility, always adapting and adjusting. It's also been heartwarming to see how people has come together to share what they know, their expertise, to improve access to care by telehealth, creating webinars, and that really, I think, has been helpful. I think in this time of crisis, where not only our physical health has been affected, but our emotional health, where we are all grieving for kind of the life we were used to, and now very uncertain of what will happen. Trying to protect ourselves by staying connected, by taking care of our loved ones, by taking care of ourselves. It has become even more important than it was before. And something that I've observed in the autism community, in the developmental disability community, is how well all of the families I work with have been able to do this, to bring resources, to reach out for help, to help each other, to share their own stories. How professionals have done as much as they can to share their expertise and help them navigate this time. I would like to end by saying that at a personal level, besides obviously all that I just shared that I've learned from them during this time, is very early on I ended up catching COVID-19, and I had one of those like kind of longer lingering courses. Most of the time it was mild, although I didn't feel great, but it ended up progressing to a point where I had to be in the hospital for a few days. And I was overwhelmed by the support and care of the families I worked with, even when I knew they were struggling at home, even when I knew they were having a difficult time themselves. They were really always checking on me, sharing their own experience. And I think that characterizes this population. The fact that even when they might be having a difficult time, they are always adjusting, always advancing. And I think that's what will help everyone come at the other side of this the best way.